toll these restrictions continue to take on people's mental health and well-being. And please understand, folks, this decision weighs extremely heavy on me. I know what this means for people to be here over a year into this pandemic. It's frustrating and it's very, very difficult.
Ontario Premier Doug Ford there on the toll this pandemic is taking on mental health. His province entered a province-wide shutdown Saturday as variants spread and health concerns grow. It's having an impact on small businesses that have had to remain closed or open, close, and open and close again. But what impact is it having on mental health? For more, let's bring in Dana St. Jean, pandemic response therapist at the Canadian Mental Health Association in Windsor-Essex County. She joins me from Windsor, Ontario today. Dana, first of all, thank you so much for taking the time to speak with us today. We hear daily about the number of cases of COVID-19, but we don't hear as much about the mental toll this virus and this pandemic is taking. Tell us a little bit about it.
So what we're seeing is individuals may be experiencing more symptoms of depression, more symptoms of anxiety, and that can include, increased feelings of frustration, and especially, near those holidays, like today, increased feelings of loneliness. So it's all kind of impacting just our overall day-to-day functioning.
And there are a lot of people who have had to spend a lot more time in isolation, people who have been heavily impacted by the pandemic. Are there signs, warning signs, to watch for when it comes to keeping an eye on our loved ones?
Absolutely. So if we're noticing any withdrawal, if we're able to notice any decreases in self-care, as well as some more fear-based kind of thinking, or if we're noticing that people are really kind of viewing the world through a more negative lens, so having a harder time kind of pulling out those positives that are occurring, we want to be aware of that within ourselves, but as well, within our family members, our coworkers, our friends, because right now we all need to support each other the best we can.
And right now, today specifically, is Easter Sunday. Traditionally, people who celebrate come together for that time. For the second year in a row, though, that's not happening. Next week, Ramadan begins. What advice do you have to people who are used to those traditions?
Firstly, is we always want to acknowledge that whatever emotions you're feeling, they're valid. Right? We don't want to be judgmental of ourselves with what we're feeling, what we're experiencing. The other piece, too, is to respect our family members, our friends' boundaries and limitations. Some people have different comfort levels at this point in time. So we don't want to pressure people to be doing things that they don't necessarily want to be doing. So even if it's that distancing, face-to-face, if people aren't comfortable over the phone versus for FaceTime, we want to be able to meet people where they're at, so we can help reduce overall stress level, and as well to be able to connect to reduce that loneliness.
Mm-hmm. Now, I do want to ask you about schools. We spoke to a teacher yesterday about how draining this all has been for him. Let's listen to Andre Metivier, a teacher.
I just wish that they would kind of look at our overall well-being, the physical and the mental, and the fact that a lot of us see the importance of keeping the schools open and see the importance of having this interaction with these kids.
Now, Dana, what do you make of what he's saying? Because I know a lot of teachers, they're saying they're working in the classroom and they're doing the online stuff at home. They're working from 6 to sometimes midnight, and they have their own families to deal with. What do you make of what Andre has been saying, what you've been seeing amongst teachers?
I think with regards to teachers and support staff, they've been working consistently through this. And in all honesty, like you were saying, going absolutely over and above for the children that they're teaching. They are the individuals that are seeing our kids, right? They're spending the most time with them, and they're having that understanding of what that in person, that connection, how that really impacts learning, how it impacts overall development. So when they're speaking of, their stressors, what I would think is, they're not only speaking for the teachers and support staff, but they're speaking for the children, their students as well.
Definitely is something to remember, an important message there. Dana St. Jean, thank you so much for joining us today.
You're welcome.